Okay, got it going.
Hello, my name is Brian Cooke. I'm a pharmacist, and I'm going to speak with you guys today just a little bit about medication compliance, safety, and disposal. Before we get started here, I'm going to just do a couple things. First, I'm going to start off with my background. I'm a 2006 graduate of Campbell University. It is in North Carolina. So yes, I had to spend about 4 years in ACC country, listening to Duke, North Carolina, and all those teams, until I got to come back to Kentucky. So I'm glad to be back here. I started out my career at CVS, worked there for a year and a half, Walmart for 2.5, and now I'm a full-time employee at St. Joseph London Hospital. But I'm also the owner of Plaza Drug and PD Specialty Care. So a lot of what I'm going to talk about is probably more geared to what we do here at Plaza Drug, because that's more community-based. That's going to be more relevant to what you all are interested in. And these are my little girls. So this is Harper, she is 3, and this is Mila, she's 6. Just want to show you a little bit about me. And I love this picture, just so you all can relate to me, because this perfectly exemplifies who they are. Harper is my wild one that's standing, and Mila is my little girl with her ankles crossed and her hands on her lap, and that's just my world now. After I moved to London, got married 9 years ago. Sorry. And that is to Brittany, and this is our 2 beautiful girls. So just getting started, some people may not be familiar with exactly what IGOT Communities is. That's something Debbie brought up to me and I got very interested in. I think long term, this is going to be something very beneficial for people who are 64 and older. I think there's opportunities basically for everyone. And kind of what I mean by that is that this can help people just stay connected and informed. There's powerful tools when it comes to your health, and we deal with that a lot, in the pharmacy world. But as we age, our needs change, especially our health needs. They're constantly changing. Mine are constantly changing, and I'm only 38. We get new medications, there's new equipment, new insurances, there's new services. All kinds of things are always popping up. So I think that this environment is going to be very good for a lot of people, just so you know what's out there, because it's confusing, it's scary. Because lots of things have changed. Because let's face it, like the baby boomer generation, to think about what's happened, technology-wise in your lifetime is astounding. So, for instance, I'm only 38. When I went to college, I didn't have a cell phone. And I'm only 38. And now my 3-year-old can FaceTime me at work. So I'm a generation or 2, but behind most of the people that will see this, but I understand, I get it. Lots of things have changed. It's hard to keep up with, a business environment, with everything that changes year in and year out. But it's just something we have to do, something we have to stay engaged in and stay on our toes about. Because there's lots of information out there too. There's lots of misinformation out there. If you spend time on Facebook, you understand. You can click on things and read complete nonsense. And that's why it's important to know who you're talking to, what their education level is, and things like that. But that's kind of a topic for a whole other day. What I'm going to talk about today, and in the future. So some of the topics are what my main focus is. I want them to be directed by you. I want to hear from you as well, like what you want to speak about. And ultimately, kind of like specific disease state management is where I would like to get into, talking about things like COPD, asthma, diabetes, and I can have different specialists to come through, to talk about things like that, which I'm really looking forward to. Talking about, multiple sclerosis, maybe the things that you think nobody else is going to know about, or sleep apnea, which affects a whole lot of people and not a lot of people know about. So there's just a lot of different things. So, as these talks go on, I would love for feedback from anybody on, hey, I want to hear about this, or this confuses me, or I don't understand this. So please feel free to let Debbie know, and we can gear these things towards you guys. But today, I'm going to start with some basic medication principles. As healthcare professionals, a lot of these things just seem very ordinary to us, but for people who aren't in healthcare, this may not be as straightforward to you. But first off, I want to start with compliance, because I'm a pharmacist, and this is what this is my world all day, every day. But let's see here. Sorry. Well, I'm just going to go over these and I'll go in deeper after this. So we'll talk about compliance, and then we'll talk about medication safety, and lastly, we'll talk about medication disposal, because that's also very, very important. That there's a lot of questions surrounding. But first off, I'm going to talk about the importance of compliance. But what is compliance? It's basically following directions, okay, which may sound easy, but it creates a lot of problems. So first off, what compliance is following directions. It's making sure you take your medicine how you're supposed to, when you're supposed to, and taking it in routine. If you fall outside of this, that's very difficult for your provider, and it'll leave you not fully treated or make your medicine completely ineffective. There's certain medications that you have to take every single day. And if you miss a day here or there, 3 or 4 in a row, then you might as well not be taking it at all. You know, because you have to have the benefit of the everyday routine. Also, it's wasteful. You know, if you're not taking your medicine accordingly, you know, nobody wants to be wasteful. And you can also be harmful to yourself and to others. And so my big thing with that, when you think of harmful to yourself, like you know if you don't take your medication, it's going to cause you problems. What about for everybody else? What if you decide not to take your insulin, and then you have complications and you have to have toes, feet removed? That is difficult for your spouse, your family, you know, everybody. And, you know, that's just part of it. Or if you decide not to finish your antibiotics and now you're spreading germs to your, you know, children, grandchildren, other people in the community, you know, because you didn't complete yours. And also, you know, dare I say it, as an older population, if you refuse to take your hormones, that affects everybody. So it is very, very, very important to be compliant, to do things like you've been told and instructed, because it's for your benefit, but it's also for other people's. And I think that's also something very important to remember, that, you know, when you don't do that, you're not just, you know, potentially hurting yourself, but it's bigger than that. Okay, so the big thing about compliance is it starts with you. We're grown-ups. Nobody's going to make us take our medicine. You know, and if you do have a spouse that helps you do that, or a family member or a friend that lays things out, that's fantastic. But it's still up to you. It's up to you to take it. It's up to you to be aware of what you're supposed to be doing and to follow through. It takes a lot of effort, and it takes a lot of planning. So if you're not willing to put in the effort, you're going to have a hard time staying up to date on your medicine all the time. So you just kind of be ready for that. Now, one of the big things that people don't really realize is that pharmacists can help, and they want to help. The pharmacist I know, everybody wants to be engaged with your health. You know, we are very concerned with what you're taking, what we're dispensing, what you're taking, how you're taking it. It's super important to us. It's what we went to school for. So there's a lot of different areas that we can help you to be more compliant. And one of those things is just a weekly pill planner. This is something everybody should have. I mean, I use them, okay? And so don't feel like, you know, that you're too old, or that, you know, that's like one of those things that you just dread doing, you know, making a pill planner. Just do it. You know, it helps you remember, it helps keep you on track, and it's very important. And there's something else called med syncing. A lot of pharmacies are working on this now. I know it's a big deal in my pharmacy. So basically, if you're somebody who's on, you know, if you're on 2 medications, it's fairly easy to kind of remember those 2. But when you're on 9, 10, 11, and 12, you know, kind of the problem is too, you don't remember what you're out of refills on when the next one's due. If you talk to your pharmacist in pharmacy, a lot of times they can help you sync those. What I mean is they can help you get those on a monthly fill. Like, let's say all of your medicines came due on the same Monday, you know, every 28 days. Makes it really, really easy to keep up with your refills, to make sure you have all your medication, to fill out your med planners, okay? Now, that is a process. It's not easy. You know, that's something you have to work with your provider and the pharmacy, but it is something that I've worked with a lot of patients on. It's been very beneficial. The other thing is bubble packing. Some pharmacies offer this, some don't. And that's basically where they drop one bubble or one pill into a little sealed, card. And that helps some people keep track of what they've taken and what they haven't. Some people like it, some people don't, but for certain situations, it's offered, and it can be very helpful.
Brian.
Yes, ma'am.
Could I ask you a question about bubble packing?
Yes.
I know that some mail order pharmacies are now putting your medicines in a little packet for the day. Is that something that's done on a local level anywhere?
Actually, so yes and no. So for starters, my pharmacy actually purchased one of these machines not too long ago. I don't know if you even knew that, Debbie, but we haven't rolled that out to the public yet. That is a service that we plan to offer at some point. But yes, it's possible. But one of the things that you kind of have to start with, you have to get all your medicines due at the same time. Because if you think about it, if you take 9 medications and you've got a refill that's, if you're out of refills on one, you can't make the whole ribbon. You know what I mean? Like if you're out of something, you can't do the whole thing. So it's kind of a bigger process, but yes, that is something we can do right now. We just haven't rolled it out officially.
So it sounds like the med syncing would be the first step.
Yes.
And then I guess the follow-up question to that, I could see how it would be easy if you take these medicines in the morning. But what if you take medicines 3 times a day, or this one 2 times a day? Will the process be eventually that, because I see this being a benefit to elderly people.
Yep.
Would it be that you would have like Monday and it would just have you would have several packs? I guess.
That's exactly how it works. Yeah. So like right now, so if you take medicines, morning, lunch, and bedtime, one pouch is all your morning meds. And these are all in a connected ribbon.
Okay.
If you want to think about it that way. So one pouch is connected to the next pouch, the next one. So you have morning, then your lunch meds, then your evening meds, and then the next pouch is your next day's morning meds. So as long as you keep rolling through those and stay in order, the next pouch is always your next meds, your next dose.
Okay. And I'm guessing, I don't know this, but I'm guessing they're dated. Would they be dated?
They're dated, they're timed. There's a pill description on there that says, this is what this drug is, this is what it should look like, this is the time you should take it. It's really, really, really nice. As you can imagine, that takes a lot more work than counting, 30 aspirin and dumping them in a bottle and capping it.
Sure.
So the turnaround time is something that we're kind of working on for that. And also med changes, if a doctor decides to, hey, let's cut this in half or double this one, the whole roll has to come back, and so there's some logistics there to deal with. And as far as the national people, I'm not sure how they're dealing with that, because my guess is that they're just.
Yeah, and I'm not sure. All I know is that I saw that advertisement through probably, I don't know, it may have been in AARP or something. Yes. I'm always looking at senior things, but sure. I just, wondered, because I really encourage people to shop local, buy local.
Absolutely.
Yep. Because it helps sustain our entire community. And so just having the availability to do that versus having to do it on a national level is to me a great opportunity for a local.
Oh, absolutely. And if you've dealt with mail order pharmacies and some things like that, that they will, like sometimes even after a doctor changes your medicine or decides to, DC it is what we call it, but stops it completely, they'll send it to you for 3 or 4 more months.
Yeah. Just
to try to build, you know what I mean? Like, cause I saw this a lot when I worked at other places, but let's say, somebody's spouse passed away. 6 or 7 months later, they come to me and they're like, I can't get them to stop sending me this stuff.
Yes.
They would bring it to the pharmacy saying, can somebody else use it? Can you reuse it? Can you throw it away? What am I supposed to do? I mean, I'm talking like, Kroger bags stuffed full,
Yeah. That happened in our family with my mother-in-law with breathing medications, and they
Yep.
just kept coming, and she
Yep.
was in the nursing home, and of
Mm-hmm.
course the nursing home wouldn't take it. So
Right.
I think these things are important for all of us to understand and know.
Yeah, they are. They are. And that's the thing, you know, when if a pharmacy realizes that they can bill your inhaler specifically every 18 days, like let's say your insurance will allow it, they'll set it up to bill every 18 days and send it to you no matter what, because they don't particularly care. But obviously that's wasteful. You know what I mean? Like that doesn't help our overall healthcare picture. And that's, like you said, I think it's very important, you know, to deal local if possible. Because I know some insurance plans won't let you. That's just the world we live in. But if you have a choice, I'm all for it. So the next thing I'd like to talk about is some safety. So, so when it comes to medication safety, this involves, you know, the prescriber, the pharmacist, and the patient. Everybody has responsibilities here. If you're counting on your prescriber and your pharmacist to always keep you safe, you're not completing the circuit. It's up to you too. Now, we all want to trust, I want you to trust me. Every healthcare provider wants you to trust them with utmost, you know, utmost ability and everything you have in you. But this is the reality. You know, when you're talking about safety, you know, and I work in the hospital, we've got lots of layers. We've got prescribers, pharmacists, nurses, every level, you know, things can happen. But that's, I really just want to bring that up because my main thing is always communication. You know, if you're not talking to your prescriber and telling them the truth, or telling the pharmacist the truth on what you're taking and how you're taking and what you're doing, you know, you're really just hurting yourself. You know, so communication is always key. You always want to talk to, you know, tell people exactly what you're doing and what's going on. It doesn't do a whole lot of people any good if you go to your doctor's visit and say, yeah, everything's fine. Well, what's not fine? You know, what's changed? You know, since we started this 2 months ago, you know, have you noticed anything different? So I'm a big communication person. So I always harp on people just to, you know, I'll always tell the truth and to have an open conversation whenever possible. So hang on just a second, I'm sorry. Okay, one of the big things I have is to have a questioning attitude. If one of your pills doesn't look right, ask your pharmacist. It's happened to me. I've been a pharmacist for 13 years now. You know, and I sent a medication home. Basically, it was the right medication, different manufacturer, but patient called me and she said, this doesn't look right. These have always been yellow and now they're white. She was concerned and she was like, I'm sorry for bothering you. And I was like, no, bother me. You know, I'd much rather you bother me than just to say, I'm sure it's right, it'll be fine, and I'll take this whole bottle. You know, it was the right thing, but you know, I told her, I was like, always call. I'd rather you call me and say, hey, did you do this right, than for me to be wrong. So that's something super important that I always try to stress to everyone. You know, have the questioning attitude. If something doesn't seem right, just ask. You know, and if somebody gets defensive about you asking, that's on them. You need to find somebody who's open that'll say, let me look into that. So so always ask. And don't be afraid of sounding foolish. I've had very foolish questions asked to me, and I've given very foolish answers sometimes. It's part of what we do. Sometimes, you know, when I first got out of school, things were a learning curve. Because it's kind of like any other profession. What they teach you, you know, is not always the real world. So don't be scared. Don't be scared of sounding foolish. You're like, oh, what are they going to think if I ask this? Listen, you know, it's what we do all day, every day. So never be scared of that. Sorry. Okay, and I kind of talked on this a minute ago, but mistakes will happen. And one thing I always try to get people to understand is like when you're dealing with your pharmacist, sometimes you got to remember, depending on their work environment, they may not have eaten in 10 or 12 hours. They may not have had a restroom break in 10 or 12 hours. That sounds extreme, and that is very normal. And that's the healthcare system we work in. There's physicians that are on call for 24 hours straight. There's surgeons. I mean, that is how things operate today. And it's not perfect, but and that's why I want to talk about, when you're talking about safety and talking about communication, that's why the more you can talk, the more people understand what's going on, the better off you are, the better off your health will be. Okay. One of the big things too, and I would always tell people, is anytime you're getting a new medication, something you've never taken before, always speak with your pharmacist. It's actually the law. The state of Kentucky requires that all new prescriptions that a patient be counseled. Now, usually they'll ask you, the easy way to do that is at the register. Most people will say, do you have any questions for our pharmacist? And you say yes or no. And a lot of times, just to be honest, you don't know if you have questions because it's new to you. So it's always a good idea to say, hey, I've never taken this before. Can the pharmacist tell me a little bit more about it? And listen, any pharmacist that's worth their weight and whatever, they would love to kind of go over that with you. Because one, that kind of provides us with an opportunity that if something's wrong, that is our last chance to catch it at the window. So if I come up to Debbie and I start going over this mess, I'm like, Debbie, your doctor's prescribed this for your prostate. Well, Debbie doesn't have a prostate. And that's something I may not have noticed, that if you're doing 400, 600, 700 prescriptions a day, that may not have registered to you. Now that I'm face to face with Debbie, I can easily tell that this meant something went wrong. The prescription came to us wrong. We filled it wrong. We chose one, you know how easy it is to mess up on a computer by clicking one wrong button. Pharmacy computers are the same way. You were trying to fill, something else that started with PRO. And now you chose ProScar, which is for prostate. And those are the things that can happen. So always talk with new medications. One of the other things I want to get to is safety also applies to how you handle and store medications. And I just want to just touch briefly on the fact that, you're not the only one that has access to your medications. A lot of times there's people in your house, there's family, there's kids, there's pets, things like that. And I hate to say this, I put this in parentheses by family, I wrote criminals, because sometimes they're the same people. The people who use your restroom, whether it's people working in your house or family or whoever, they go through your cabinets. And I'm not trying to be mean, I'm trying to be transparent. They want to know if you have pain pills, nerve pills, whatever else they can get their hands on. So I just want to throw that out there that when you're talking safety, this is a big part of safety. It's keeping people from being able to steal from you, to abuse your medications, to get addicted to something, that you're actually on for a legitimate reason, that you're being treated for, and they're using you, to fuel their habit. So I always say lock up medications that may be abused. And you may not know what people are looking for to be abused, but if you're on something for pain or nerves or muscle relaxer, those are the types of things you need to, store somewhere else, put them in a lockbox, anything. Just, keep them away so people don't understand. Because like I said, I've heard stories of people saying, hey, I had this person come into work on my house. 3 weeks later, I got broken into and they wiped out all my medicine. Because they were in there and they used the restroom and then they knew everything you had. Okay, so my last major topic is going to be proper disposal, because this happens a lot. Over the years, you accumulate medicine. As a nation, we don't throw things away. We kind of hoard and hold on to things. Medication's the same way, because you think, well, what if I need this again? And that's okay. It's okay sometimes, depending on what it is. But my advice, routinely check your expiration dates, just to keep an eye on it. And don't forget your OTC medicine. So OTC stands for over the counter. So that's your Tylenols, your Motrins, your laxatives, things like that. Things that you don't use all the time that may be in your cabinet for 5 years. Because we don't all need, Imodium for diarrhea every week. You may just need it a couple of times a year. Then all of a sudden you've got something that's 6 years old, and so that's not what you want to do. You want to kind of turn those things over every year, and just keep an eye on them. So the question is, what do we do? What do you do with these medicines? Our community offers take-back programs a couple times a year. Some of those are at the police post. I think I've seen them at the farmer's market a couple times. Different areas will have big take-back programs where you can just bring in whatever you have and just turn it over. There's no questions asked. So if you're worried about, oh, I've got, grandma's medicine and it's not got my name on it, that's not our concern. Our concern is getting that stuff, out to where it can be, taken incorrectly or taken by the wrong person. So those programs are great, but those only happen a few times a year in our area. Now, we do have return bins in Laurel County. There's one at the sheriff's office and one at the London City Police Station. And they look like mailboxes. They're these big green canisters. You can walk in and you can dispose of all kinds of medicines there. They have a few more restrictions, like for aerosols and things like that. But you'll just have to check and see exactly, what you're trying to return versus, what they'll accept. But those are great options because those are available all the time. I encourage everybody to take full advantage of those. So when you're paying your property taxes at the sheriff's office, that once a year you go, think about it then. Think, well, let me go through my medicine closet before I go back. Let me get rid of some of this stuff. And a lot of people ask me about trash and flushing. So you can legally dispose of medications in the trash. What the FDA recommends is that you either put it in coffee grounds or kitty litter. They want you to basically kind of corrode it, break it down, put it in something that nobody's going to dig through and try to get that out. So anything like that, you put them in a Ziploc bag, you can put those in the trash. Some people have asked me about flushing. Now, in general, you don't want to flush medications because they will end up in the water supply over time. Now, the FDA does recommend some medications can be flushed, and usually that's on a need basis. So what I mean is basically if you've got pain pills, nerve pills, something that it's kind of dangerous for you maybe to hold on to, if you're not being prescribed those anymore, and you're not able to get to a return site of any kind, those are okay to flush. So it's kind of one of those things like if it's more dangerous to keep, then you may, if you're worried that somebody's going to come over and, try to get your, pain pills that you want no part of anymore, that you had for a surgery, those are okay to flush. You just don't want to have them. You can't get to a return bin. Those are okay. But that's kind of if all the other options are unavailable, then that's okay. Okay, guys, that's all I have this time. But for kind of my opening talk here, I do look forward to coming back and talking about more specific things in general. So if you've got anything you'd like to hear from Debbie, please let her know. If you've got any questions for me, you can find me on Facebook. My name's Brian Cooke, so I'm kind of open all the time.
Brian, I'm going to ask you just a couple of questions
Sure.
if you have a few more minutes.
Sure.
Of course, currently we're at the Medicare open enrollment period of time where people are signing up. And can you address Medicare and prescription drug plans and why it's important? A lot of people don't understand if they're 65 and they're not taking medication, they don't sign up for Medicare Part D, and then later on they're penalized for that. Right. But can you address in any way the importance of Medicare and prescription drug plans? And then so that's one kind of question, but the other part is, so there are people I know who get in what's called a donut hole, and so their medication's one price, and then all of a sudden they're paying just unbelievable amounts of money. Right. And what are some of their options, and how do people best address those periods of times? If you if you have any ideas.
Sure. That could probably be a topic for like an entire day because it is complicated, and the complication is the problem. You know what I mean? Because you've got people who, the terminology is not easy to understand. It's an elderly population that, these plans didn't exist when you all were growing up. Insurances didn't exist when most of y'all were growing up. You went to the pharmacy, you paid $4 for whatever, or $5 for whatever you wanted because drug prices were so low. Most pharmacies could dispense whatever they wanted for $5. And now, I've got I ordered a medication last month that was $7,000 for a month.
Mm-hmm. Yeah.
You know what I mean? And those are the things you have to, that you have to weigh and balance. Now, as far as the different plans, there's so many of them. The best thing to do is to go to your pharmacy, get your medication list, what you take, and then talk to a couple different plans. And there are different agencies, and I wish I could probably get some of that information together, but they basically specifically work with people on picking a plan. But if you have your medication list, you can go to and say, hey, what are, which plan works best for me? Mm-hmm. And I'll get into this later in another talk, but I'm on a very expensive medication. So plans matter a whole lot to me. If you're on 5 or 6 drugs that are all generic and they're all $3 or $4, that's a completely different thing. You're not worried about the donut hole, like Debbie was talking about. If you had to pay out of pocket, $15, $25 a month, that's doable. If one of your medications costs $240 or $500 or $1,000, you're going to have to talk to them about a different plan, that'll work for you. But going back, my biggest advice is to have your medication list and kind of know what you're taking and which plan is going to work best for you. And always talk to somebody independent, like an independent person who works with multiple plans. Because if you call United Healthcare, guess what? United's got the best plan for you. Mm-hmm. If you call these different plans, they've got the best one for you. So it's usually good to talk to a consultant that's kind of independent.
And Brian, so anybody who needs their medication list, they don't have to sit down and write it because they may forget part of it.
Right.
They can just come to the pharmacist and say, can you print me a medication? My medication schedule.
Yeah. You may have to sign a form because it is a release of health information, mm-hmm. Kind of like what you do for taxes. If you've ever gotten your list of copays, they can print that list out so you can see everything you're on. That kind of helps people guide you to your best possible answers. Mm-hmm. But it is complicated. Like I said, there's not a very quick and easy answer, to that as far as picking a plan. But it is important to have a plan. Mm-hmm. You may be like you said, you may be somebody who's fortunate and you're only on one medication, and it costs you $4 to $10 a month. That's awesome. But you know what? Things happen. People get cancer. People have all kinds of diagnoses made, and it is very, and if you get one of those, that's crippling. That's crippling, to all of your finance, all your savings, everything. So, even if you take a very bottom tier, Medicare plan, it's very important to have one at least, and to know kind of, especially cancer drugs. That's one I bring up because those are some of the most expensive. So that's something to look at specifically. If you're a smoker, you need to know, or you're a tobacco user of any kind, you need to know, what may happen there because obviously, that is something, cancer is very prevalent, in that population. So that's something to kind of be aware of all the time.
Yeah. And one last question. If somebody is prescribed a medication and they've done this, I know this gets complicated, but they do their own research about that medication and then they get afraid to take it. Mm-hmm. What's their best option in that case?
Always talk to your pharmacist. Always talk to your physician. Pharmacists, I put them first because we're the most easily accessible. That's one of the things I love about my job is you can walk into a pharmacy and talk to someone who has a doctorate level education without an appointment. You can just walk in, whatever questions you got, we're right there. So I love that part about my job. But come talk to us because if you dig online for certain things, you're going to find the worst. Mm-hmm. And you're going to find a lot of misinformation, like what I said. When it comes to drug side effects, they're real. So I'm not trying to downplay them. But when a lot of drugs are studied, if a side effect happened in one person, that has to be reported. Mm-hmm. One person. So you know what I mean? When you talk to your pharmacist, we can give you percentages to say okay, when this was studied, what you're worried about happened in less than 0.1% of the people who took it. Like we can kind of give you an idea, or I'm on a medication, one of the side effects is like over 35%. That's relevant. Like that, that's something to be aware of. That's something to be, to be concerned about possibly. But, we can kind of guide you through those things and say, yeah, if this happens, then it can be an issue, but otherwise, keep an eye on it. It's, we can kind of navigate through your entire health picture. Like I said, if you do notice, some kind of side effect happening, it's always good to talk to your prescriber too, because they have more of your medical records than we do, so a lot of times they have chart notes that I don't get to see. And so they may be able to draw that back to something else. So that kind of goes back to that whole communication thing, because I can see your med list. I can't see, what Dr. So-and-so said 10 years ago. Yeah. And that makes a big difference. I have the luxury at the hospital. I can pull up most of that stuff, which is very, very nice for me. But, when you're working out here, I can basically see your med list and I can talk to you. And that's about the extent of everything I can be aware of.
Okay. Well, thanks for sharing today. And I'm going to go ahead and stop this recording here briefly, but I'm going to get it uploaded to our site so other people can observe and watch this as they need to. And that way, as we go on through the process of these classes, people will maybe be more excited about getting on and actually being able to ask questions. So I'm going to stop the recording now. So